So, I mean, just given your knowledge of CTE, what is your take on the study?
Well, you're going to hear this number, Brooke, 96%, and it's going to be staggering to a lot of people, and for good reason. I mean, 96% of the brains, again, former NFL players, showing evidence of this disease, CTE, which I promise you most people had never even heard of a few years ago. You know, we visited the lab where this research has been going on. The research has been going on since 2008, and we saw firsthand how they're actually looking at these brains and trying to determine, do they in fact have these signs of CTE, which are very similar to Alzheimer's disease. So these people developing sort of an early onset Alzheimer's disease, that's what we're talking about here. Now, I do want to point out an important caveat, Brooke, and that is that what happened in these cases is players who are concerned while they're still living that they may have developed some symptoms of CTE are typically the ones who've had their brains donated to this particular lab. And I point that out just to say it's a self-selected group of people. We're not suggesting that 96% of all NFL players have this disease, but still, it's a pretty significant number, and they've got now 7 years worth of data.
But what about, and I know you've talked a lot about too, you know, taking it from professional athletes down a notch to, you know, people who are playing football in college or in high school. Is this something that they need to know about? Should they be worried about this?
I think they absolutely do need to, and there's a couple of important reasons. First of all, Brooke, I mean, when you went to high school, when I went to high school, people talked about concussions as getting your bell rung or something like that. It was sort of almost, you know, trivialized a little bit. And now we think of these things as traumatic brain injuries as opposed to just getting your bell rung. It changes the whole dynamic. It's important because a lot of concussions go undiagnosed. People don't report them. I think as a result of these sorts of studies, people are more likely to report them. But also, you know, it's not just football. There are other sports where you can develop either concussions or even subconcussive hits. These kids' brains are still developing at that age, so it might even have more of an impact on them. You know, the chief health advisor for the NFL, a recently appointed position, Dr. Betsy Nabel, I had a chance to sit down and talk to her about this. Take a listen.
Any contact sports is going to have a risk of injury. We see that in soccer, for example, women's soccer. I think what's critical is knowing how to play the game right, knowing how to play the game safely. If you understand the best way to tackle, if you've got good equipment in place and you know how to recognize injury, then you're going to play the game as safe as possible. And if you're really driven to play that game, then I would feel comfortable.
I could tell you, Brooke, Dr. Nabel there, Dr. McKee, who's actually running the study, they're sports fans. I've talked to them both. They love these sports. They love football as well, but they think it can be done safer. And if it's done safer, hopefully some of these astonishing numbers will actually go down. People won't have as many brain injuries.